Students, let's study the second chapter of Civics, Role of the Government in Health. First of all, let's see what is health. Health means ability to remain free of illness and injuries. We need to be healthy. When are we healthy? We are healthy when we take proper diet. We take proper drinking water. If we are in pollution free environment, then only we can be healthy. Now let's see the healthcare in India. India is the largest number of medical colleges in the world and among the largest producers of doctors. India gets large number of medical tourists from many countries. Okay? India is the fourth largest producer of medicines in the world and is also a large exporter of medicines. Most doctors settle in urban areas. Why? Because they cannot get proper salary or they cannot have a better income. So, in rural areas, so they avoid there and then they settle in the urban areas in the cities. Okay. Now, though the government has made healthcare centers, hospitals, laboratories, and all, but still, in our village, the proper treatment is not available, and that is the main reason why people in the village are more sick because they cannot afford the treatment in the cities, and at their villages they do not have all the facilities. Public and private healthcare services. Let's see first the public health services, that is PHC. This is a chain of health centers and hospitals run by the government. Okay, the government take cares of this public health services and hospitals. Okay, now such centers cover many villages in rural areas. At the district level, in the district hospital, that also supervises all the health centers. Okay, the health service is called public for many reasons. Okay, another important function of public health is to take action to prevent the spread of disease such as TB, malaria, jaundice, cholera, diarrhea, chikungunya, etc. According to our constitution, it is the primary duty of the government to ensure the welfare of the people and provide health care facilities to all. The court also said that it was the duty of the government to provide the necessary health services, including treatment in emergency situations. Hospitals and medical staff must fulfill their duty of providing the necessary treatment. This public healthcare facilities is being given by the government, whereas private health facilities is not run by the government. Okay, the government has no control over them. Public have to pay a lot of money and to get a better service or treatment for them. Okay, now healthcare and equality. Is adequate healthcare available to all? In India, private health services are increasing, but public health services are not, as cost of these private services is high. Many people cannot afford this private health services. Private services sometimes encourage practice which are unethical. Barely 20% of the Indian population can afford medicines that they require during an illness. Okay, it is the responsibility of the government to provide quality health services to all its citizens, especially the poor and the disadvantaged. In 1996, in Kerala, decentralized its health budget at panchayat level to ensure effective health services or health planning for their state. Okay, the best example of healthcare comes from Costa Rica. In Costa Rica, the government provides for adequate health to the people. For example, it provides safe health education. It provides safe drinking water, sanitation, nutrition, and housing. Health education is also considered very important, and knowledge about health is an essential part of education to all levels. Okay, so with this, the chapter ends. Thank you.